Do you get hay fever or allergic rhinitis? Have you ever looked for an app to help you manage your condition, but had trouble finding one that's right for you, one that you can trust? Professor Cynthia Bosnick-Anticevic from the Woolcock Institute of Medical Research is part of an international group that's working to make things easier for patients and healthcare professionals searching for a good app. So Cynthia, why might someone want to use an app for a chronic condition such as allergic rhinitis?
Most patients do need some support in self-managing of chronic illnesses because it's something that they need to be, vigilant and committed to basically every day of their lives. That's very difficult to achieve. And it's thought that apps can be a way of supporting that. They're there to sometimes remind the patient of what to do, but they're also there to help the patient better understand their disease so that they can be motivated to continue to do that health behaviour, which in most instances is use their medication.
And what sort of problems do people have when they're looking for an app?
There's lots of them out there, and they can basically be developed by anyone. For a patient, it is difficult whether they realise it or not. I mean, if they wanted to find an app, they do have a lot of choice. And they, from their perspective, will have something maybe that they like for whatever reason or that they're attracted to initially for whatever reason. But then from the healthcare perspective, there are certain things that you would also want to be or not to be in that app. So even if patients want to go and select their own, which I think would be very challenging for a patient, to be honest, because how would they know which one out of, if you've got tens of them or hundreds of them to choose, how would you know which one's going to work for you? And do you have the time to look through it?
It's almost as if there's an overabundance of hay fever apps out there.
The abundance, I think, it opens choice, but I think it can also add to confusion.
So your international team has developed an app for people with allergic rhinitis called Mask Air. Can you tell us about the app?
So what the app is trying to do is it's trying to give people the opportunity to actually input how their nose is, how their eyes are, and if they have asthma, how their asthma is, to give them a more holistic view of where they're at. And this particular app uses what's called a visual analog scale. So the person on a bar has to say from not at all troublesome to completely troublesome along a scale. And that's very easy. So basically with a press of a button, they will be indicating what level of symptoms they're experiencing. And then over time, they get a little chart. It shows them how they're tracking, and they can input whether they've had their medications and which ones they've taken.
And there's another benefit from people using the Mask Air app, isn't there? Can you tell us a bit about that?
So when the patient inputs their severity and whether they've taken their medication, there's obviously data generated. And the Mask Air captures that data. So the Mask Air database, it's de-identified, of course, so you could never match it to a particular patient. But over time, you can match the data for one patient. So there might be, patient number XX57 or something, but you have a longitudinal history for that patient. And I think the fascinating thing, and this paper is going to come out, it's not published yet, is that by collecting this data now, which has been over years, we're actually able to find that there's different subgroups of people with allergic rhinitis. We've actually been able to learn more about the disease state and patients' behaviour. So that's a paper that's coming out, which I think is going to be really, really important, because it's going to say, yes, it's there to help the patient, the app, and if the patient wants to share the app and the data with their healthcare professional, together they can do some decision-making around that person's condition. But it's actually, as a healthcare community, it's enabling us to understand the diseases better. So it's actually really exciting.
And finally, what would you say to someone who is thinking about getting an app for their hay fever or allergic rhinitis?
I think what we would say is something like, is your hay fever bothersome? And do you feel you'd like to try an app that might help you self-manage? And if you are, why not give Mask Air a go? It's simple and has all the key features to help you self-manage. That's what I would say. Give it a go.
That was Professor Cynthia Bosnick-Anticevic from the Woolcock Institute of Medical Research. The Mask Air app is available for free from Google Play and the App Store. For more information about Mask Air, go to www.mask-air.com.